Hola, good evening, everyone, and thank you so much for joining our kickoff event for our Southern California chapter's Cafecito series. I am Stephanie Flores, currently serving as the SOCAL NALHE Board Secretary and Project Manager at Kaiser Permanente. I get to share the pleasure of welcoming you all today. The purpose of our Cafecito series is to provide a forum where healthcare leaders can share their expertise, insights, and any leadership advice that they may have. And then again, as mentioned just now, please note that tonight's session will be recorded. We may take some pictures for social media. And so I will now introduce our moderator for the night. That's going to be Ana Maria Castro. Ana is project manager in the Office of Community Affairs at Children's Hospital Los Angeles. In her current role, she manages community relations and outreach. She works with state, federal, and local elected officials, business leaders, and other key stakeholders to promote children's health. Having previously worked as a promotora, she facilitated a connection between community members and physicians by bridging cultural and linguistic gaps. Prior to joining CHLA, she led a team of over 70 and oversaw operations in the Environmental Services Division at Providence Holy Cross Medical Center. And prior to transitioning to healthcare, she worked for Univision as a general assignment news reporter and producer in LA, Sacramento, and the Phoenix markets. She currently serves as the president of our Southern California chapter of the National Association of Latino Healthcare Executives. In her role, she's bringing together healthcare leaders, industry experts, and affiliates to discuss and influence factors which impact the representation of Latino and multicultural individuals in healthcare leadership roles. And so she does it all. She also is a mother of a teenage son, enjoys hiking and traveling. So we thank you so much, Ana, for your leadership. Go ahead. I give you the mic.
Thank you. Thank you for that warm welcome and introduction, Stephanie. And I want to welcome all of you to our Cafecito series, Cafecito con Edwin Rivera. And it is my pleasure now to introduce him. Edwin Rivera is a highly accomplished healthcare executive with over 2 decades of experience in various sectors of the industry. He has held leadership roles in hospitals, medical groups, health plans, and government. Additionally, Edwin's expertise extends to the oral health field, where he served as a senior vice president of external engagement at Sonrava Health, a nationwide company focused on oral health. During his time at Sonrava Health, Edwin led public relations, reputation management, and community engagement efforts. He prioritized building relationships with underserved multicultural communities, ensuring access to much-needed oral health services. Edwin's commitment to outreach initiatives and partnership development helped address oral health disparities and promote quality care. Edwin's dedication to community service is evident through his involvement in nonprofit boards. He served as the chair of the board for the WALL Las Memorias project, driving initiatives for wellness and HIV/AIDS prevention advocacy. Currently, he is an active member of the Executive Board of Directors for Latino Health Access, contributing to improving the health and well-being of the Latino community. As an active member of the National Association of Healthcare Executives, Edwin remains at the forefront of healthcare innovation. His diverse background includes notable positions at Western Dental and Orthodontics, Regal Medical Group, Molina Healthcare, HealthNet of California, Ultimate Health Services, St. Agnes Medical Center, the Latino Coalition for Healthy California, and county government roles. Edwin's extensive experience provides him with a comprehensive understanding of healthcare delivery and administration, particularly in diverse communities. Edwin, welcome, bienvenido, grab your cafecito,
Gracias.
and let's begin this important conversation.
Let's do
Thank you
that.
so much for being us. Okay, so to begin, tell us a little bit about yourself, your cultural background, and how you got started in the healthcare industry.
Of course, you said a lot about myself, so I feel I should not say anything now because you said it all, right? But first of all, thank you for inviting me. I'm very glad to be here, very honored to be here. As you know, NALHE for me is it's a great organization where I have volunteered my time and I loved. So let me tell you a little bit about I was born and raised in Puerto Rico and moved to California as a young go-getter, seeking new horizons. And although I didn't know a soul here in the United States, I really wanted to, make a life for myself, specifically on healthcare. And my first job was at the County of Fresno Health and Human Services Agency. And this particular assignment showed me how public service has so much power. And I found purpose, making a real difference in my community. My government work lit a passion for leadership in me. I learned how to motivate teams, manage budgets, and create innovative programs. This prepped me for the next chapter. Advocating for healthcare access, I joined the Latino Coalition for Healthy California, expanding coverage for underserved groups. I worked tirelessly educating families on their options and brought together advocacy groups to drive policy changes around equity. And this is before equity was like a buzzword out there. So that I'm very proud of that. I ultimately wanted to drive change on a bigger scale. So at that point, I joined corporate health insurance, and my background helped me develop solutions to improve outcomes. I helped conceptualize, develop, and implement a cross-border health insurance product, and that was one of my biggest accomplishments. And although I consider myself profit-driven, I still advocate for people's needs. My career has been defined by community dedication and the belief that healthcare is a basic human right. I later worked for hospitals and medical groups, as you mentioned in my bio, gaining inside knowledge of the healthcare challenge. But it was a complex organization, complex environment, but I found belonging in those organizations that were united to heal. I also saw gaps in care for disadvantaged folks. To help, I joined nonprofits promoting health equity for minorities and LGBTQ plus individuals, and I still serve in these causes today. I unexpectedly, about 6 years ago, I pivoted into the dental world, and I worked for Sunrava Health and their Western and Brighton dental brands, one of the largest dental services organization in the country. And where I touted the message that linked oral health to overall well-being. Poor oral health actually impacts the entire body, right? So I continue to promote whole person care, which is very important. My diverse perspective and complete understanding of the big picture in healthcare, and it's my driver to empower communities, and it has only grown since then. I look forward to combining my leadership skills with health insights to increase access, advance equity, and help people thrive. I'm proud of my impact to know there's always a little bit more to do.
That's right. Yeah. One can never stop learning, right?
Yeah, correct.
So Edwin, can you share one or two examples of how your work has been rewarding and why?
Yeah, definitely. I've had some awesome experiences. I am super proud of my career. But my time at Regal Medical Group is really special and meaningful to me. As one of the biggest provider groups in California, Regal served a diverse community with lots of healthcare needs. I started the community engagement department from scratch to help seniors better understand their options and get the care they deserve. I knew that just handing brochures would not cut it. So we tried something new. We teamed up with Angelica Maria, a famous Mexican soap opera star that everyone adores. And that experience and her celebrity status and her kind heart made her the perfect person to connect with the Hispanic seniors. We made videos, we answering the common Medicare questions and shared them at clinics as well as in community events. It all worked very, very well, and I am very proud of that. Seniors were stoked to see a familiar, friendly face explain complicated topics, as we know, like coverage and coordination of care. The providers also learned more about their patients' concerns, and most importantly, seniors felt empowered to take charge of their health. Our work really sparked positive change. And as we involved health insurance companies and broker agencies in our journey, that only helped us. Beyond the results, this experience let me mentor my team in a meaningful way. I showed them how key is to involve the community and make programs for real people. We learn hands-on how grassroots outreach can uplift their voices. Ana Maria, while we had lots of twists and turns, this program stuck with me. Seeing Angelica bond with elderly fans and knowing we moved the needle on health awareness, it just felt right. It fuels my ongoing quest to educate, involve, and empower through creative solutions. I'll carry this lesson, humanizing healthcare, with me forever. I also carry the lesson that even mammoth systems can be humanized through compassion and tenacity. If I can continue creating little ripples of good, I will feel fulfilled in this kind of work.
And she's a huge celebrity in Mexico and all over Latin America. Who doesn't know Angelica Maria, right? She's everybody's tia.
I know. La novia de Mexico, and I call her La novia de Mexico because everybody knows.
Wow, that's amazing. So based on your experience, how do you define effective community engagement, taking into consideration principles of diversity, equity, and inclusion, like you had mentioned before?
Okay, yeah, that's a very good question. And through all my different healthcare jobs, from working directly with patients to health plans, hospitals, and dental offices, I've seen very close how important real community engagement is and what a huge impact it can have. Doing it right means embracing the diversity of who we serve while making sure everybody has a fair access and a say. At its core, it's about building trust. And you're going to hear me say trust so many times because it's so important. That means not only telling folks about what's available, but making the effort to truly get into the community, to each community, and learn the unique needs, their values, their challenges, their strengths. And for Latino communities, especially, taking time to understand the cultural pieces like language, family ties, faith, and perspectives on health and well-being is the key. When organizations team up with local groups, such as churches, schools, and local leaders, it builds that crucial trust and understanding. Then healthcare can be tailored to really resonate with the community. Even more, it gives community a real voice in deciding their own health priorities. True community engagement is grounded in diversity, fairness, inclusion, and empowering people to participate. By helping community partners understand healthcare, the complexity of healthcare, while learning from their real experiences, we can really shape solutions together that make measurable gains in access, outcomes, and overall wellness for the community. The reward is a lot healthier communities, and a lot of communities that have equity attached to them.
That's right. Yeah. And, I think you touched on this, but the key indicators that a community engagement initiative has been successful.
I'm sorry?
I think you touched a little bit on this, but what are the key indicators that a community engagement initiative has been successful?
Yeah. And Maria, as we know, there are several indicators, but I'm going to focus what I consider like the top 4 or 5. The first one is active participation and leadership. A core indicator of success is that community members are actively participating and taking on leadership roles in the engagement initiative. This shows the community has taken ownership of the effort and sees value in being involved. High participation numbers, the community volunteers, resident-led programs, and local leaders championing the initiative that you are promoting are some of the positive signs. Another thing that we can look at this as an indicator is sustained partnerships, which is important. If you make a partnership and that partnership stays over the months, years, and whenever the initiative is, it's when it requires collaboration from stakeholders, organizations, and other partners. If partnerships are continuing and expanding, it demonstrates that the stakeholders see the benefits working together beyond a single event or activity, which sometimes we just think of one event, one activity, and take it in isolation. But no, it's more than that. Strong two-way communication and feedback loops should be in place as an organization to measure that this particular community engagement activity is working. If the shared goals are achieved, there is definitely an indication that what you're doing is working. At its core, effective community engagement is about aligning to achieve shared goals that improve people's lives. If identified outcomes around things like health, education, economic opportunities, and quality of life are being accomplished through collaborative efforts, it's a good measure of impact. Tracking the progress on joint goals reflect that community voices are helping to drive real change. Another important indicator is increased trust and understanding. There's the trust word again, right? When diverse community groups and institutions build mutual understanding through sustaining engagement, it just develops greater trust and social capital. Success can be measured through assessments of relationships among partners, as well as formal or informal surveys on trust in local leadership and institutions. And last but not least, the community ownership and activation. So over time, effective community engagement empowers the communities to take greater ownership over the programs and initiatives. This might involve community volunteers, managing programs themselves, and neighbors spearheading new efforts. When the community is activated to identify opportunities and catalyze new solutions, it is a sign of meaningful engagement. And I'm going to cite an example, an organization that I have the honor to serve on board of directors for many years, Latino Health Access, in the city of Santa Ana, a nonprofit entity that have been using promotores, the promotores concept, and I'm glad, Ana Maria, that you were part of that. You were a promotora for many years. And this is kind of one of the secrets to increase engagement in the community. You know, their success is based on that. And I think it's a model that we as in corporate America and in healthcare in general need to embrace.
Very good. Yeah, the promotora role is gaining momentum. And I think a lot of people are recognizing the importance. Okay, let's go on to our next question. How do you ensure that community engagement strategies are flexible and adaptive enough to address changing dynamics related to diversity, equity, and inclusion?
The most meaningful community engagement strategies are designed hand in hand with the folks who lived in that community. That way, programs can fully address what matters to real people and families from the start. But priorities change, as we all know. So we have to keep checking in to make sure activities stay useful. We send surveys, hold neighborhood meetings, and create advisory groups from the community, because this gives the community ongoing ways to guide our work in our organization. Together, we decide how to modify things when new needs pop up or more voices need to be heard. As we know, communities are not stagnant. They're always changing. By teaming up and on making changes, the community stays motivated to keep participating. And the goal is to be flexible and listen closely, not stick to a rigid plan. So we have to be very flexible, and those plans have to change. If they don't change, you're not doing the right thing. Programs that can adjust to how people live, how people's lives are changing, will do the most good. That is the beauty of true partnership. It lets the community shape their own path forward with the help of whoever the corporation or the healthcare organization is. As head of community engagement for a dental company who partnered closely with schools in the neighborhoods that we serve in many states, we provided dental screenings, healthy habits workshops, and also provided hygiene supplies to the schools. When regulations change or new school leaders came on board, our community and our school partners helped us out. They help us adapt and change whatever measures we had in order for it to continue working. We collaborated on adjusting our programs to fit the rules while still meeting the local needs. And when neighborhoods change due to either political changes or other reasons, our community partners sounded the alarm, and together we evolved our outreach to ensure it resonated across all community levels. That is something very, very important, that listening to the community, listening to the leaders, listening to the partners. And finally, by maintaining open communication and trust, we're able to roll with changes. Our community partners make sure our programs stay relevant. That is a great thing about true collaboration. It creates engagement that can flex and grow even in shifting times. And the community gets the services that they want and need. And those services have to be meaningful for the community.
Wow, this is great. So just to reiterate, priorities change, and being adaptable is key to success.
It is. It's key to success, and also key to gain that trust between the community and the organization that is doing the engagement efforts.
That's right. All right, our next question. Collaborations with local leaders and organizations are crucial, especially in advocating for social justice. How do you build partnerships that are not only focused on immediate engagement goals, but also on driving long-term systemic change in the community?
Well, Ana Maria, first, we get to know each other and realize we share similar hopes and goals for the community. That is the most important part. That's step number one. This prepares us to think big picture from the start. When we do that, we not only learn about the community, but also show that we truly care for the issues that that community is confronting. Then we make plans that include skills training, leadership growth, and empowering programs. Not just temporary fixes, like I mentioned before, but activities that will help the community in the future. That is very, very important. I try to give our partners access to whatever resources I have. Those resources can be with me directly, or it could be resources in the community that could help their work down the road. Things like data, connections, funding opportunities for nonprofits, participating in community groups, events, and even joining some boards in the organizations that serve those communities, because those are the ones that know the community the best. We keep lots of open communication going all the time. This is like continuous. In that way, we can keep making things better as the community needs change, which we know that they will change because that's the world that we live in. This also serves to build trust and learn from each other, which in turn will help the community. I involve our partners in making decisions and leading programs. This helps their influence continue and help the trust the community has on those particular partners continue also. So it's like a win-win situation. We use our combined power to advocate for community-friendly policies in government, and this may include inviting government officials, elected officials, and policymakers to learn about the community. This is a specific tactic that I used a lot on my last job with Sonrava Health, where we invited elected officials to come in and learn about oral health, and which many times is underfunded. People don't know about the importance of it. And it's also to highlight how oral health impacts health on the rest of the body. I've always had this mentality that you don't have to officially be a teacher in order to teach. I spread the word about our partners' amazing work so more people take notice. And this can include social media posts, when I speak on conferences, and shares whatever they do. As having partners that participate in company-sponsored events also helps so they can reach more people. The main goal is to build each other up so we can become change makers. Real progress comes with when communities think strength, especially in our underserved and in our Latino communities. Does this explain my approach to partnerships? I want to make sure that I'm on the right track.
Yes. Yes, thank you so much for your insight. And we're going to get to questions at the end. So if anyone needs clarification or they have additional questions, they can pose those here with us. But I'm going to get to just two more questions on professional development. What are some reminders you'd like to share with healthcare professionals regarding the promotion of quality and equitable care for their patients?
There's so many things that we can do as healthcare professionals and administrators, and some of them are common sense and can be used in any service industry. A classic and simple example is greet every patient with a warm smile. First impressions matter. Something that I always share with my teams in healthcare is comparing customer services when you go to a fun event, a movie theater, or something like that, versus when you go as a patient to visit a doctor or a dentist. In the first example, people are eager to go. You choose to go there because you want to, right? So the demeanor is quite different than if they have to visit a healthcare facility. There's always stress when you go to a doctor or the dentist, especially a dentist, and that is something that we sometimes we overlook. In having that demeanor, being a professional with the client, not only helps them feel more at ease, but also will have the visit outcomes immensely. Really listen carefully to their concerns. Let them fully share without rushing. I personally appreciate when I visit my healthcare providers and they take the time to listen to me. When a patient feels he or she is being listened to, they tend to comply better with the provider's directions. Make sure you explain things simply and clearly. And I want to emphasize on this because in healthcare, we use a lot of medical jargon, right? So let's try to limit the use of medical jargon if we can, and especially abbreviation. We use so many. There's the PPO, HMO, HIPAA, POC, etc., etc. So there's so many things. So I always recommend speak like you're speaking to a 6th grade level student. And I don't want to sound condescending with that. I mean, the simpler, the better. You must also watch their facial expressions and body language too. Make sure that they are comfortable. Also, give your full attention during visits. Don't multitask, even though we tend to do that a lot, or seem distracted. Show them that at that moment, they are your #1 priority, and that's it. There's nothing else in between. Document patient needs and history. Share with other providers as necessary to coordinate care. And this is very important, just in case there's a need for a follow-up and you're not available. Another important part is to make sure that patients understand that you are there for them, that you are helping them, and thank them sincerely for choosing you as a provider. Most patients have a choice, and it means so much to the patient. Don't we all appreciate when someone is grateful for whatever we do? Gratitude is the key to open doors.
This reminded me of, I went to a doctor visit a few years ago, and this doctor kept looking at her watch. The whole time that she was talking to me and we were talking about important issues, she kept looking at her watch, and I'm like, do you have to be somewhere? And so,
Yeah.
now you're hitting the nail with,
listening. Yeah, in summary, it's treating
100%.
each patient with patience and kindness. That's great. I think quality care comes from the heart, and as healthcare professionals, we should have that.
Yeah, that's right. So I now have a different doctor. Okay, what advice would you give an entry-level professional wanting to grow their career within healthcare?
Yeah, when I talk to students or people who are entering the field, especially Latinos, there are some pieces of advice that can help them propel their careers. Like in the previous question that you asked me, some of these things are common sense, but some others are you need to think about it. The first one is continuous learning. Never stop learning. Healthcare is an ever-evolving field, as we know. And the more you learn by attending, either you can stay updated on the latest trends by doing research, but also, attending conferences, pursuing other education certifications, some workshops, and that will enhance your skills and knowledge. Another thing that we can do is networking. Networking is super important, especially in this day of age. Building a strong professional network, both with your organization and the health community in general, is important. That's where NALHE comes in place. Networking can provide opportunities for mentorship, collaborations, and even potential job advancements. Next is to seek feedback. Sometimes we forget that, and sometimes we take it in a not so positive way. We should actively seek feedback from supervisors, colleagues, and mentors. Constructive feedback and criticism can help you identify your strengths and areas of improvement, enabling you to make necessary adjustments as you and grow from that. You also must develop what we call soft skills. These are skills that might be taught in school and might not. And I'm referring to communication, empathy, teamwork, and leadership. These skills are vital in healthcare, where interactions with patients and colleagues and stakeholders are very, very frequent. And something very important that we sometimes forget to do is set goals. As simple as that. You should define short-term and long-term career goals. Having clear objectives will give you direction and motivation. It's kind of like your driver through that journey. Regularly assess your process and your progress, and adjust your goals as needed. A key trait that will help anyone propel their career, and I know some of you have heard me say this before, is to be flexible and adaptable. As we know, healthcare is dynamic. When changes, so many changes in regulations, technologies, and patients' needs. Adaptability is crucial in this field. Embrace the challenges and be open to learning new skills. Don't ever get stuck on that. That's not on my job description pitfall. It might not destroy your career, but for sure it will put a barrier in advancement. And another important key to advance and succeed is to show initiative. Take the initiative, volunteer for projects, propose ideas for improvement, and go the extra mile. Showing your dedication and enthusiasm can really set you apart and lead to new opportunities. And for new entrants in the field, seeking mentorship is very important. I know the national organization and also the local chapters always have opportunities for students and career entrants to do this. And you need to identify experienced professionals who can guide you in your career journey. And a mentor can not only provide insights, advice, and support, but they can also be a sounding board for your ideas. Something that is very important in our field because of all the demands and requirements is to stay resilient. And this is the selfish part. You need to make sure that because of all the stress and all the demands that healthcare has, develop resilience to cope with stress and setbacks is very important. Practicing self-care and seeking support when needed is essential for maintaining a healthy work-life balance. And very important and timely advice is to embrace technology. Healthcare is increasingly integrating technology, especially with the advancements on artificial intelligence. Be willing to adapt to new software, electronic health records, and telehealth platforms. These tools are becoming an important aspect to modern healthcare practices, especially after COVID. AI is something that is moving at light speeds, and learning how to manipulate it for your advantage is crucial. And finally, remember that career growth takes time, effort, and patience. Stay committed to your goals, remain curious, and seize opportunities for growth and learning.
Wow, those were all very helpful tips. Thank you for that. But you know, I was thinking right now about communication, right? So even though we're Latinos, we come from different parts of Latin America. I once had a teacher who, you know, I came when I was a little bit younger, when I was like 9 years old. I came from Mexico City. And she said to me, ay, bótalo. So when she said bótalo, I took the paper that I had and I just threw it because I understand botar like bota la pelota, right? But she meant bótalo, like tíralo a la basura. So do you have any experiences where like the different connotations and different you know, in one country botar means to throw away, and another country means to kind of bounce a ball? That stuck with me ever since I was a kid. Do you have any experiences that are similar?
Oh yeah, and by the way, we in Puerto Rico, we're supposed to like salsa, right? And they the other day someone told me that they weren't revoking my Puerto Rican card because I said salsa was not my favorite musical genre. But that also makes me chuckle when an experience that I had when I first moved to California. I came from Puerto Rico to the Central Valley, specifically the city of Fresno. And there I was working as an eligibility worker for the County Health and Human Services Agency. And around May, very close to a Cinco de Mayo celebration, as a matter of fact, I was told there was a salsa contest. My thoughts at that moment was, how cool this place is to work. We're going to dance. My coworkers could not stop laughing. Their thought is like, this kid has no idea what Mexican salsa is. So I think that was very, very funny. But on a more serious note, like you mentioned, it's a classic example of how we as Latinos are very diverse. Different words can mean different things. Some words can get you in trouble if you use them. And as a healthcare professional, having that understanding is crucial to provide the best service to our patients. And by the way, this was many years ago, and now I for sure know what salsa is, and I love it.
What's your favorite salsa?
Oh, I don't have a favorite one. I like all of them as long as they're not super spicy. I'm okay with them. I've learned to tolerate spice. In Puerto Rico, we think we eat spicy, but those spices are totally different than the Mexican spices.
Than the Mexican one, yeah, the Mexican chile. All right.
Oh yeah. Yeah.
All right. Well, okay, so thank you so much for sharing your wisdom with us, Edwin. And now we're going to open it up to questions. Please feel free to unmute yourself or type in your question, whatever you prefer. Do we have any questions? Or Stephanie, do you see any? I might have missed some in the chat.
Yeah, so I didn't see any in the chat, but this is absolutely meant to be a fireside chat. So, like Anna mentioned, you're free to unmute yourself and go ahead and ask, since we have Edwin's wisdom here today. So, I think
Yeah,
oh, yes, go ahead.
yeah. So Edwin, and I'm a fan of what you've done throughout your career. I've learned so much working with you. And can you talk a little bit about the political aspects of the community engagement that sometimes the brands or companies, organizations don't understand, since you don't have like an actual how much money are we making with this kind of, how do you manage the political aspects? How do you ask for budget to do events that they're not going to necessarily get money back right away, like a return for their investment? How do you manage that?
Yeah, well, I just go on my knees and beg, please trust me, this is going to happen. No, on a serious note, that's a very good point. Many corporations, they always look at ROI. What is the ROI for this or that initiative, right? And many times the ROI it might not come right away. And second, it might not be measured on money. It might measure on branding. It might measure on that trust that you gain from the community. That later, let me take an example. You work for a healthcare insurance, and the healthcare insurance has some initiatives in your community. You are with healthcare insurance X, and you don't see healthcare insurance X as part of the community. When it comes time to decide, and you see healthcare insurance company Y, you go like, you know what? This company actually is doing something for my community. I remember them being in this event. I remember them helping the community food bank, those things. And then the customer will come because as we all know, Latinos are very loyal. And they're loyal when we, like any community, when the corporation really shows that it's not that financial ROI. So that applies also, Fermin mentioned politicians and all of that. And how do you explain to them that this is worth doing? So that's the way, they need to have a clear understanding and cannot have unrealistic expectations that this is going to happen overnight, that we're going to start an engagement initiative now, and in 3 months we're going to start seeing them. You might get lucky and you might be able to develop some relationships that you probably had before and kind of like transfer that into wherever you're at. But most of the time it takes some time, especially if the organization haven't done that in the past. Did that answer your question for me? Okay.
Sorry, I had to unmute. Yes, it did. Thank you. I know you have a lot of experience in that, so I wanted you to touch on that because I've learned so much from watching you juggle the necessities of the community and sometimes, executives and companies that don't understand, or it hurts them to sponsor events and things like that.
Yeah. And one thing that I need to add is like, I consider myself, the leader, right? But that doesn't mean that I am everything. That my success, I owe it to my team. The people that work with me, not for me, but with me, because we're all a team. We might have different titles, but we all have the same goal. And that's how you are successful, to make sure that you have those people behind you, helping you implement those initiatives. You have the big ideas, and then they have that talent to go out there and implement all of that.
Edwin, I have a question. And first of all, thank you for all the good work you've been doing in the communities you're serving. I think in recent years, especially with health equity and different funding streams, I think of CalAIM and really policy changes that are putting more money to community support and promotores programs, et cetera. Do you think that there's still more on the financial side that we could be doing from like a state perspective? And given those changes and the fact that there's more funding now for those type of wraparound services, what do you think is sort of a two-part question? I apologize for being a long one, But so one is, do you think there's enough funding going in now? And the second part is, what is the next sort of barrier to address? Is it getting out of our silos, or how
Mhm.
do you see that kind of changing?
Yeah, you asked the question and you answer it too, by the way. So that part of getting out of our silos was going to be part of my answer. But in let's talk about California specifically. California is a state in which in the last decade or so, healthcare had become the forefront, and the state government sees healthcare as a right. So we have been doing a lot of things to include everybody, regardless of their citizenship or immigration status, to be able to receive healthcare. Because the important part about that, a lot of people say they're handouts, but they're not. That take COVID, for example. If you have a child that is an undocumented immigrant, comes to the school, has the virus, and has no health care, that pandemic, that epidemic is going to cross. They don't look at the diseases and viruses. They don't look at immigration. So I think that's very important. I think that the CalAIM goal of integrating care is a start. It's a good start. I know that it will take years because the systems are so complex. And you look at California and you have like the Northern California, you have Central California, or Southern California. It's like having three states. The demographics are totally different. And implementing that type of initiative at a state level is going to require time and, of course, more money. But the good thing about that is that they're finally looking at whole health. They're finally looking at, at mental health as part of that whole health, as well as a dental, oral health as part of whole health. And I think that will really, really help improving the outcomes in healthcare for our communities. That's very, very important. And the other item that we need to look at is that, like you mentioned, we work in silos, and many times, let me give you an example. Dentist, a person comes to a dentist office and they get their blood pressure taken, diabetes and oral health care are very linked. And the dentist might not be able to bill if they do an H1A1C or any of those testings, even though they're capable of doing it, but they're not doing it because they will not get reimbursed. So that is something that at a macro level, we need to look at, and we need to look at how we can improve those administrative tasks, those issues about reimbursement, all of that, to make sure that a dentist can bill for diabetes because they know what they're doing, or MD can bill for oral health. And I think the best way of doing it, and I know there's some pilots in the state that are happening right now, San Mateo County, for example, where they have everything under one roof, basically. So you go to a doctor, and dentist is there, and the mental health professional will be there also. So in that way, you don't have to be going from place to place to obtain the care, which everything is linked. It's not that we can take our head off and it's like, okay, send the head that way because I have mental health issues or oral health issues, and then my body goes to the orthopedic surgeon or whatever. We are one body, and we need to make sure that healthcare reflects that. So I don't know if I answer your question or you have any follow-up.
Definitely. Appreciate that. Thank you.
Of course.
Okay, I see one question in the chat from Ellen. How can hospitals and health systems work better with community groups to reduce disparities of care and access?
Yeah, that's a very good question, and it brings me to the point that you see certain organizations, you see health insurance companies, for example. You might see some medical groups working with communities in order to improve that. And we rarely see hospitals. Hospitals are kind of like on a silo. They take care of people when they're sick. And there's some systems that are different, that they're out in the community, they're involved in community activities. But I think, to answer your question, hospitals should be more open to really understand what happens in the community. And some of the things that I mentioned during the questions that Ana made me, understanding what the community needs, understanding such things as basic as who is part of my community. Is it majority Latino? Is it majority African American? And kind of embracing that and learning not only when I say the hospital, obviously it's not the hospital, it's that the people that work there and being more involved in that. But everything boils down to reimbursement, right? You cannot run a profitable organization unless you get reimbursed. And these things many times are not reimbursed. I am glad to see California, for example, now that has the community health worker or promotores being part of that some organizations are able to get reimbursement for that. And I think that is the key to really learn. The promotores are part of the community. These are the trusted healthcare or trusted individuals in the community that people listen to. And I think involving them in policy making, involving them in the decisions that the organization make is very, very important.
Thank you, Edwin. There's another comment here. I'd love to learn more about the positive outcomes in terms of research methodologies used and what were or has been some of the challenges and how have you led your teams to overcome those challenges?
Yeah, one of the major challenges when it comes to community engagement is measuring it, right? And I talked a little bit about ROI a moment ago. And it's like, how are you able to show to your leadership or to your board that what you're doing is really working? That you have 12 community engagement workers out in the community, and how do you measure that? So coming up with a strategic tracking to track the work that they do is important. Many times, marketing or community engagement cannot be directly measured. But for example, I'm going to give you an example that we had in Texas. And this is the way this is the method that we use. We had a region in Texas in which we increased partnerships with brokers, healthcare companies, and other community organizations. And we measured the growth in those areas and then we compare with an area that is similar to that in the same state. And we saw that other area, there was no growth. So that is a way of showing that. But to my point, measuring and tracking engagement activities, it's very, very difficult. So the organization has to be open to understanding that this will impact growth, and they have to believe that this will impact growth for the company, and making sure that they do that. Then another aspect of that is the feedback loops that I talked about. That is something that many times is just hearsay in a sense, but you can have some organizations that are trusted in the community that can be witness to the efforts that you have done. They see how your support, even in human resources or through grants, have impacted that community. So that's another way of measuring community engagement.
Thank you, Edwin. Let me see if we have more questions here. Paola Gonzalez, how can Latino healthcare providers who want to network and work with healthcare leaders in the administrative side and community side to help diminish healthcare inequities? How can they work together?
Well, I think network is the first step. And I'm gonna pass it to Ana because she is the president of the Southern California NALHE chapter. And I know, Ana, you can talk a little bit about those activities that NALHE does that exactly answer that question. So
yeah,
I know I'm to answer, but I think you're better than me to answer that.
No, thank you for this. But yes, Paola, networking is super important. As Edwin mentioned, you never know who you can meet, and you can land a job with an important healthcare system. So here at NALHE, we have a leadership summit, an annual leadership summit. It takes place during the Latino Heritage Month. And it's a great opportunity for you to connect with healthcare executives from all over the country, all walks of life, all different levels. And yeah, you connect, and we even offer like mock interviews for early careerists. We have sessions where you can sit down with Wheat Kiefer, which is someone that we partner with, that they have resume building, and they advise you on, you know, what you should change. We have professional headshots that you can take. Yeah, so come and learn more. NALHE.org. Thank you for the plug, Edwin. Come and learn more. And if you have any questions, feel free to reach out to me. I will put my email address on the chat in a few minutes. But yeah, I would strongly recommend networking. You expand your network by also attending different organizations. We also have ACHE and WHA, Women in Healthcare Industry. So we stay tuned, because we are actually partnering with 4 more organizations, and we're putting together a networking mixer in October. So that, you know, that should help you make all these connections.
Yeah, because you know, to add to what you're saying, Anna, you know, everything in life is about relationships, and building those relationships with key individuals, key organizations might not help you right away, but it will increase your power in a sense to understand the community better. And whenever you need something else, you know, you might, you know, like, oh, I remember Anna works for a children's hospital, so let me connect, and that's how the networking helps you. And then also you might be, if you're a new career entrant, it might help you obtain, you know, a mentor, work with someone that can listen to you, that can give you some criticism on your ideas and things like that. So that's very important. Associations like NALHE are prime to do those things.
Mm-hmm. Yeah. Okay, we have one more question. You mentioned the importance of self-care. How do you recommend managing the demand of growing professionally within healthcare and prioritizing well-being?
I think well-being should be your top priority, regardless, because you know, if you're not well, you're not going to be able to do anything, right? Just think when you're flying. I'm an airplane freak. I love flying. I love traveling. And when you go on a plane, they tell you those instructions that, you know, put your mask first before you put it on someone else. And that is a great analogy. You know, we need to make sure that we take care of ourselves. That is not something that, oh, if I have time, I'm going to go to a gym. Oh, if I have time, I'm going to do some meditation. You know, that is something that should be part of your routine before anything else, because it is the most important part. So that's how you prioritize that. And then together with that is that, you know, you might think that networking doesn't help you, but it does, because you might be able to sound ideas. You might be stressful for X or Y situation that you're going through as a healthcare worker, but you can talk to someone else that also went through that situation, and they can help you come up with some things that you might not be thinking about that can help you move forward on that area.
A different perspective, right?
Yes, exactly.
Yeah. Let's see. Oh, Paola, she says the hard time is getting your foot through the door sometimes. Okay, make note of it. Next year, the Leadership Summit will be in Dallas. So put it in your calendar. She says she won't be able to attend this year, but hopefully next year. Does anybody have any anything that they'd like to share, or any positive experience out of networking? Maybe you met somebody and it led to an opportunity, a funding opportunity, or a connection that, you know, maybe got you to the next position. Does anybody want to share? Can anybody think of a good Oh, Paola's in Houston. Oh, yeah. So we'll be in Texas.
You're close by.
Close by, yes. Paola, you have a question.
Yeah, I just wanted to mention, for me, where I found something that I kind of stumbled upon is, as a healthcare provider in oncology, I was just talking to a drug rep just to understand one of the drugs that we were working with. And I mentioned to her how I wanted to be more of an advocate for my patients, especially for the Latino community. And lo and behold, she actually knew of an organization through Pfizer that is specifically working on opening and advocacy and patient education and access opportunities for Latinos. And I'm actually going to be invited to their steering committee later in October. So it was just kind of like a spur of the moment situation that led to exactly what I'm aiming to do. But that's kind of how it works. So it's just funny how you mentioned that, and that happened today.
Yeah, that's
That's
great. That's great.
wonderful.
And
Yeah.
another thing, Paola, for you and for everybody on the call, think about joining boards in the community. You know, that opens the door for you to learn more about that particular community, and also will help you network. You know, it will give you the opportunity to help that organization with your experience. And many times, boards are lacking, you know, people that are on career entrance, and that is a perspective that all boards need. You know, at Latino Health Access, where I'm at, we dedicate 2 positions on the board that are for youth representation, you know, because we serve the entire community, and that person doesn't have to have an MBA, that person doesn't have to have an education. For God's sake, they don't even have to be working. As long as they understand the community, that gives good perspective. And there's many organizations out there throughout the United States that will welcome people like you, or like people that are entrants in careers, to help them learn. Because as a leader, you know, I've had decades of experience in healthcare, and I learn from people who are entering careers now, because it's mutual learning. You know, I left school a long time ago, so it gives you a different perspective for things. So think of that.
Stephanie, did you have a question?
Oh my gosh. I guess honestly, I don't want to open another can of worms. I just wanted to kind of pick Edwin's brain as far as like being at Latino Health Access, a nonprofit, and I know that it was in the middle of the COVID task force. So I think maybe if you had just one of the biggest takeaways for any organization to kind of get buy-in, you know, like there needed to be such a quick turnover, you know, anything that you feel is something that we can all take away.
Yeah, you know, I always when I talk to people regarding Latino Health Access, I always say that organization was learning to battle a pandemic like COVID for 25 years, because they you know, we never thought something like that will happen. And when the pandemic hit, the promotor model was something that really helped the organization and propelled the organization to change minds politically in other communities, you know, all of that, because they started. Let me give you an example. They I don't know if you all remember, when COVID started, they would tell us, okay, if you get a positive test, make sure you isolate yourself. For me, it was easy. You know, I have a big place. I can go to one room. My family can be in another room. That's fine. But when you tell that to 3 families that live in a 1-bedroom apartment in Santa Ana, how are they going to isolate? It's almost impossible. So for the general leadership, that was common sense. But then when LHA started raising those concerns, then they said, oh, that's why the Latino community is like there's the highest incidence in COVID, because they can't do that. So that started creating programs to really help that. So, you know, if you get tested and you're positive, we're going to help you to go to a hotel room and isolate yourself. Don't be close to your family, because what's going to happen, you're going to give it to everyone else. So that was one thing. Another thing that happened, and I remember when, you know, there were food banks because people were not working. They cannot do that. But most of the food banks were drive-through. And when you look at certain communities, they don't have a car. They use public transportation to go, or they walk to go to place. And I know of cases that people would go to a food bank and they would be denied food because they were not in a car. And the purpose is like, it's a drive-through, so you have to drive. So LHA came up with this great idea. They started working with a food bank in Orange County and other food banks. Northgate Markets was an organization that really helped, where they just had boxes, and the first part of the food bank was like drive-through, say from 8 to 11, and then from 11 to 2, it was like people walking in, and that also helped to educate the community, because they're standing in line. You needed to keep the 6 feet apart, and the promotores were able to educate them on COVID, the importance of vaccinations, all those different things that we were talking about at that time. So I think that's a great example of how organizations like that are able to make a big impact in community. In this case, literally life or death.
Thank you, Edwin. And I guess just to end on a positive note as well, you were the one that told me to forget to have fun. And so I wanted to open it up and ask you what are ways that you have fun as well in the middle of everything else?
Yeah, we cannot forget about laughter. I remember when I was growing up, there was a book that my family received. It was like stories, the Reader's Digest, right? And it had a section that was called La Risa, Remedio Infalible, which is like laughter is the best medicine, right? And I truly believe in that. And even, just try it. You are stressed out and you are like, oh my God, what am I going to do? Just even if it's a forced smile, it would change your attitude. But if it's read, make sure that you do that. Myself, I'm a big Star Wars fan. I don't know if you can see that, but that is a way to escape. I escape to a different galaxy. So it is. You have to do that. You have to take care of yourself, and that comes with self to being resilient. That's part of it. Make sure that you try to keep yourself in good spirits, because otherwise you're gonna pass that. Negative energy is something that you'll detect right away, and patients will detect that right away. Talk about that doctor that was looking at your watch when you were there, right? You kind of like grab that and you're like, what's going on? So and I know healthcare is very serious. Sometimes you might be talking about life and death issues, but I think there's always a place to humor. Just be careful, because you cannot be joking about death when you have terminal cancer and you can die. You don't do that. There's a time and a place for everything. But as a healthcare provider, you can impact your patients by doing that also. Have fun in whatever you do.
Wow, thank you for that. And we're going to close it up because we are over time. Thank you, everyone, for those extra minutes that you stuck around. Edwin, mil gracias por todos tus consejos. We appreciate all your wisdom, and we're going to put them into practice. And if you want to learn more about NALHE, just log on to our website, nalhe.org. If you click on Southern California chapter, you'll see more information on our chapter. And then stay tuned for any upcoming events. We have a leadership summit September 13th through the 15th. We have a joint networking event coming up in October. I don't have the exact date yet, but it's in October. And then we have the posada. So we have an annual posada in December. And so stay tuned for that. So thank you, everyone, for joining. And it's a little hasta luego, okay? Because we're going to be seeing each other soon. Thank you so much, everyone.
Thank you, everyone. Bye-bye.